Okay, hello everyone, chapter 3 now. And again, here you see, oh, where is it? Oh, yeah, give me a second. I'm starting mine. Yeah, that's good. So you see here, now the chapter 3 word list is here. I think chapter 3 is the longest one so far. But anyway, let's start it. First, oh, why I'm doing this all the time. Okay, good. Yeah, I, you, good. OSIS. OSIS is more a neutral word. It is not necessary to be good or bad. It means a condition or process. For example, we just mentioned before, uh, osmosis. That's the special diffusion of the water. In here, we check about necrosis. Necrosis is a cell death. And cell death has at least two words: apoptosis. Yeah. E. Apoptosis. Apoptosis. Anyway, yeah, I was right. Yes, apoptosis. The T theoretically should not be pronounced at all, but many people still pronounce the T apoptosis. But anyway, apoptosis and apoptosis is not in the list, but apoptosis and the necrosis is normally both refer to cell death. So it's often compared to each other. Apoptosis is a program cell death. Say this is cells, and I say I don't feel bad, I don't feel good, and then in the cells, the DNA start to degrade into small pieces, and then the cells are divided into several small pieces. In the whole process, no cell contents released into the environment, and the body doesn't feel anything. No, say inflammation caused by necrosis. In the case of necrosis cells, it's a sudden death. For example, a trauma, a pressure push here and causes cell death, so the cell is ruptured. Many of those cell contents are released to the environment, to the interstitial fluid, and then it normally causes a local inflammation. So that's a different necrosis, apoptosis, and then let's next there are three words: kyphosis, scoliosis, and lordosis. So what's the difference? All of those refers to the the uh, bending of the spine. The spine is the bone that support our upper body, and the spine itself is not uh, not straight. From side view, the spine it looks like this. Something. I believe I'm right. And then, but from the front view, it should be straight. Okay. Then what is what is kyphosis? Let me double check. I'm looking into my cell phone now to see whether my spine is drawn correctly. Oh, see, that was not right. It should be, yes, that's right. So this is the neck, chest, abdomen, and hip. Okay, so, and then what is kyphosis? Kyphosis. That is, yeah, that's one. So it means the upper back here is hunched. That's called kyphosis. And then lordosis is the lower. So in the case of kyphosis, this guy is kind of like this. No, that's not. No. Let me see. Should be. No. Basically, the hunchback. People have hunchback. And then lordosis is the so people with kind of the belly is put in front. However, this one, scoliosis, is the side bend. See, this in the front should be very straight. However, these people may have a bend. This is a brown wheel here. So that's a different type of bend of the spine. And that's it for the spine curving. Okay, next one. And then there's a very often used word, itis. Itis means inflammation. But what the cause of inflammation is very complicated. We'll talk about some of those. First, hepatitis. Hepatitis can be caused by many different things. Virus, including HAV, HBV, and HCV. Hepatitis A, hepatitis B, hepatitis C. And also metabolic. Metabolics, I believe, at least in the United States, is more popular than virus induced hepatitis. And for example, you may have heard of fatty liver. Fatty liver itself is not hepatitis, but if fatty liver further processed into NASH, then it's hepatitis. When it's hepatitis, the liver cells start to die. And then dermatitis. Dermatitis is normally we refer to the itchy rash on the surface of the skin, which in most cases, unfortunately, we do not really have the clear explanation why it happened. Normally, it's treated with steroid, hormones to treat them, glucocorticoids, or the. I'm not even sure my spelling is correct. And for example, eczema. Eczema, yeah, right? Eczema is one type of dermatitis. And endocarditis. This is the internal lining, inflammation of the internal lining of the heart. In most cases caused by bacteria, fungal infection, which I think is not very often. So, otitis, hot, ear infection, ear inflammation. This is mainly caused by infection, by bacteria or fungi, especially for example, meat-ear infection. You may heard it. It's I think it's very popular, and it's not anything that untreatable. But people will have fever, ear pain, like this, but tend to be good again with antibiotics. So then what's next? Gastritis. 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 Whatever. So gastro, stomach. And then stomach inflammation And in many cases, it is a common word used. I'm not sure, but it mainly caused by we have acid in the gas. The one causing this is the stomach right here, and then on the surface of stomach, there's a lining of mucus that protect the stomach cell from acid of mucus, and then the cell of ulnar cells. You don't really have to know this. I'm not even sure my spelling is correct, but anyway. So these cells can be damaged. What kind of things can damage the cells? How to spell apple? Yeah, yeah. Oh, and bacteria. So when these cells are damaged, the mucus is gone, and then acid will damage. Let me see. Will go further damage the lower cells, and then they're causing the stomach pain. And what this can go further. Ulcer, stomach ulcer, gastric ulcer, and then gastric cancer. And by the way, this is the very first cancer that people first discovered that actually caused by bacteria. The next one. Nephritis. Again, kidney. Nephritis. Kidney inflammation. And kidney inflammation. Kidney is far away from infection. It's quite unlikely to have kidney infection in the kidney. But when it happens, it's way more serious than just a kidney inflammation because it's kidney failure. Actually, sometimes bacteria going back, trace back to the urinary tract, causing a kidney infection. That's very bad. But here, nephritis is often referred to immuno attack. We call it autoimmune. Autoimmune attack. We talk better to know this word. Autoimmune attack means immune cells of the body attack its own cells. It's used a lot. Many without diseases actually causing by autoimmune disease, for example, lupus. Lupus is the antibody actually attack the DNA. So many cells are affected, including the kidney. So nephritis is often caused by other autoimmune attack, for example, lupus. And arthritis. I mean, you've heard it. That's the joint pain, joint inflammation. There's at least two types of major arthritis. Osteal, and rheumatoid. Both have these two are different origin, but both eventually damage the cartilage of the joints. Without cartilage, the joints are no longer smoothly moving around. And then what's the next? Oh, yeah, good. Now we finish the eye deformation. And next, let's talk about neuralgia. This thing is, oh man. Sorry. Yeah, is pain. Not much to mention. So, neural I'm not even sure if I can pronounce it right. Neural pain. Neural pain is the nerve. The pain is along the sharp, severe pain along the nerve. I mean, I never had it, but I heard it's very, very bad. And myalgia, muscle pain. I don't know. I have muscle pain right now. Just sitting here for data. Atalgia. what was it? Ear pain, whatever. Yeah. Arthro. Yeah. Uh, joint pain, etc., etc. Gas. How to pronounce it? I don't know. This thing. Is it more often people just mention stomach instead of gastralgia? I don't know. Heart, yeah, whatever. So, but yeah. Anyway, this is the algia means pain. Then let's keep moving on to sclerosis. Oh, sclerosis. We have only. Right? Wow. Why there are so many words in this section? Oh, no. Where is it? Okay. Sclerosis. Roses, the status, scleral, heart, the status being heart. Yeah, anything being heart called sclerosis. And then sclerosis actually is a pretty bad disease. And here the example given by the syllabus is called arterial, arterial, arterial sclerosis. That means the artery become heart. And what is used more often is I put here arteriosclerosis. Arteriosclerosis. Arteriosclerosis is, I just mentioned here, as I mentioned earlier, using the angioplasty open up the artery. Why you need open up the artery? Because arteriosclerosis. What is arteriosis? Again, actually mean the small arteries become hard. And why become hard? It's actually more complicated. This I'm not sure. Should I say mention this? This briefly mention this. Say right. The all the blood vessels are lined with a special cell called endothelial cells. And then in some cases, there are some thing called LDL deposit in the blood vessel. And those LDL and these are should be removed by macrophages. But macrophages when they come, they can eat everything but cholesterol. And when cholesterol stack out inside the macrophages, they forming when the cholesterol accumulated inside the macrophage will die, become a foam cell. Then foam cell accumulate become a flake. And the flake is that you need to look all of the most of those pictures you find online is wrong, but after process because many of those they draw something like this and stick up. In this way, it's much easier to remove those. The thing is, before the macrophage die, here become foam cells, they penetrate the endothelial cells to beneath the blood vessels. So it's very difficult to remove them because they are not even inside the blood vessels. They are beneath the blood vessels. That's why it's so difficult. And this process is called atherosclerosis. And then so far, again, we have no way to remove those atherosclerosis. And I guess the most efficient way to treat them is the angioplasty treatment. Let's keep moving. Malacia means soft. Something become soft. So I don't know. Do I have to write all of those? Tracheomalacia means the trachea becomes soft, and the laryngomalacia means the larynx. And where is it? So this the mouth. Okay, look the mouth, and then going down. This is called pharynx. And then from pharynx this way, this big one, this is the larynx. And then following larynx here, this is the trachea. And then this part is esophagus. Esophagus. Yes. The food pipe. This is the air pipe, air pipe. So either this one or this one becomes soft. And what's the balance? What's that? I mean, anything can go wrong with it being soft. The airway may be blocked, so it's not strong enough to support the air to pass through. And it's not that rare for newborn, but in most cases, those people just recover by themselves. In a very severe circumstances, people need to do trachea transplantation. And the good news is the trachea you can use. One of the it's one of the early. I mean, so far the very few things we can really using a man-made material to replace the real stuff. So yeah, and then what's next? Osteomalacia, soft bone. Oh no. Yeah. Osteo is the bone. Malacia, the soft bone. What can cause soft bone? There's two things. One is there's hormone called parathyroid hormone. Parathyroid hormone this is the bone, and calcium from the bone to the blood, and this is how parathyroid hormone do. And then this is the digestive system, and this is food. Calcium, how you can promote calcium from the food to the blood. Vitamin D. So either you do not have enough vitamin D, or you have too much of the parathyroid hormones, the calcium getting out from the bone into the blood. And even though you have a higher level of parathyroid hormones, as long as you have enough vitamin D, you have enough calcium in the blood, it's still coming back to the bone. So vitamin D is the key. And onychomalacia, I don't even know. Yeah, this means nail. Nail. So soft nail. What happens with soft nails? And infection causing the nail to be soft. Okay, let's keep moving. This is something diagnosed coming from nowhere. Diagnosis. Trying to figure out what's wrong with the body and what kind of people do diagnosis. Many, all of those physicians and surgeries have to do diagnosis, but pathologist, we just learned, is very specialized in diagnosis. And emesis. Hyperemesis is vomiting too much vomiting, and it's often referred to people with pregnancy. Normally, pregnant women has the normally they feel nausea, but too much vomiting is hyperemesis. And then emetic, anything that induce vomiting, emetic. Antiemetic, medicine, whatever, prevent the vomiting. Antiemetic. Let me see. Urea, yes. Next, let's have a urea. We will see. There's a lot of things about urea, and it's not really The diarrhea. That's probably the most popular of the rhea word. Diarrhea, watery feces, watery stool, diarrhea. Rhea means, let me see, running, a flow, or too much. So diarrhea, and then pyorrhea. Pyorrhea, is by the word called pus, too much pus. But however, this doesn't really mean the pus is growing. So that's a teeth, teeth grow to the bone socket, and then above the bone socket, you also have the gum to protect the teeth. However, if you have this infection here, and then you get a lot of mucus here, pus here, and then this, they call it pyorrhea. And pyorrhea is another name called it periodontitis, inflammation, surrounding odon, surrounding teeth inflammation. Even give a long time, this may result in the teeth loose. I think I have this later. Okay. And the renal, again, rhea, runny nose. And I think nowadays, I don't think people still use the renal rhea. Even the most, the actinic fevers, they say runny nose. And what else? Menorrhea. Just the menorrhea, actually, this is nothing bad. Just regular run of the menstrual blood. Let's see. Hemorrhage. That's another thing used a lot. Hemorrhage. Hemorrhage means bleeding. Not really excessive bleeding, just bleeding. For example, stroke. I've heard of stroke, especially brain stroke. The brain stroke has two types: hemorrhage brain stroke and ischemic brain stroke. Ischemic brain stroke means this is the brain, whatever, and then there's some blood here. It's blocked, and then this region becomes lack of blood because ischemic stroke. And hemorrhage stroke means it's flow, and then the hemorrhage stroke is more dangerous because when the blood coming out here, the blood forming a kind of clotting, and the brain is inside the scalp. If this blood forming a clotting, then it takes the space, push the brain. When it pushes the brain too hard, the brain has the inflammation, and then people may die from it. So hemorrhage is more dangerous than ischemic. However, for hemorrhage stroke, if people survive for the first 28 hours, there's a much higher chance that people will just recover. Other than ischemic stroke. Ischemic stroke is blocked for forever. So let's see what else. That's it. Good. And then that's it. That's it for the rhea. And let's moving on to what is this? Up. Mega, big. Megaly, become big. So any word followed by megaly means become big. I mentioned this, acromegaly. Acromegaly is a disease related to growth. You may have heard of growth hormone. Growth hormone is supposed to produce in the early stage of life, not really childhood. It reached the peak. It reached the peak of puberty, and some people still producing this till 20s. However, if for some reason, and then for the rest of life, something like this, and now for the puberty, 14 and 24, and then for the rest of life, still growth hormones, usually in the very low concentration. However, for example, some people have tumor grow in the pituitary gland, which is the place that will produce growth hormone up here. And then the problem is after this places, this is a long bone of human being. This called growth plate. If the growth plate still have hardest here, the bone can grow longer and longer. One after say 20 something, it's gone. It's gone. Now the bone can no longer grow longer. So in this case, if you keep giving it too much growth hormone, the only way is the bone can grow just thicker. It can only grow thicker. And then other tissues like fat, subcute, other connective tissues all grow bigger and bigger. And it's just like turn out the guy is not grow taller, only grow thicker, and turn out to be in most cases turn out to be very ugly. Yes, the people's face are changing. This is called acromegaly. And what else? Hepatomegaly. Liver. Megaly become bigger. And and liver become bigger. And the liver become bigger itself is not a big deal. And however, it's often referred to some other things affecting the liver. For example, Gaucher's disease, and I think malaria also have a increased liver, and many. So larger liver itself is not a big issue. However, it can reflect those other. It's a sign of other diseases, and the same for cardio. The same for cardio. Battle. So, with the case, cardiomegaly is still the heart become bigger. And again, the heart become bigger itself is not harmful, but it reflects something else like heart disease, hypertension, etc., etc. And that's it. Next, we talk about this. Anemia is blood, and anemia is no blood. Anemia means not enough red blood cells. Not enough red blood cells can be caused by many things. Maybe the thing that's the least serious is the iron deficiency and some other radiation, and many other things like sickle cell. Sickle cell, now we call it sickle cell disorder, but before it all called sickle cell anemia. And hypoxemia. Hypoxemia means low oxygen in the blood. Low oxygen in the blood. There's another word called hypoxia. Hypoxia. This word means low oxygen. This is in the blood, and this in the tissue. That's how it's different. And for hyper, high, health, the potassium is iron, anemia in blood. So high calcium in the blood. What can cause this one? Hypercalcemia in most cases. In Vietnam, and not in most, but in many cases, kidney is supposed to get rid of the actual potassium in the blood. But if you have too much, the kidney cannot get rid of it. And then also very severe dehydration. Severe dehydration can also have hyperkalemia. And let me see. And other thing is one very special execution to kill the criminals. Inject the calcium into the blood, also called hyperkalemia. And then hyperkalemia is really high. It can stop heart beating. That's called in the execution of so, and then hypercalcemia and hypocalcemia. So hypercalcemia, let me see. I think it's relatively rare. It's caused by, again, the same hormone, parathyroid hormone. Parathyroid hormone is produced by parathyroid gland. Something wrong with parathyroid gland, for example, developing a tumor or cancer, they produce too much parathyroid hormone to get rid of the calcium from the bone into the blood. And hypocalcemia is the most common is because the vitamin D deficiency. I didn't say calcium because calcium, you still need a calcium from the food, but in many cases, it's more often that people do not have enough calcium, vitamin D, than calcium. Because without vitamin D, no matter how much calcium you have in the food, you cannot absorb those. Let's see, let's keep moving. Good, we're almost done here. Hypernatremia or hyponatremia. This is low sodium in the blood. Sodium, the sodium chloride, that's the salt we eat. We need a sodium. Sodium is very important iron mineral in our body. And in our body, sodium is always coupled with water. So in most cases, how much water means how much sodium. So in this case, it's hypernatremia, high sodium in the blood caused by dehydration. And hypo caused by overhydration. And it actually can be also very dangerous, especially especially hyponatremia. For example, babies, infants cannot drink water because their kidney is not well developed to get rid of the actual water. So they have to, if the baby has a diarrhea, they need to drink the special infant water, which contains electrolytes. And even adults, they cannot drink too much water. Actually, I think there's a contest of who can drink too much water. It's so stupid contest. And then I heard, I don't know, it's only a story or rumor or it's true, but I heard a lady who is a champion of drinking water contest died after the contest because too much water. I don't know this rumor or true or not, but it's true. Is in the summer, many people develop this hyperhydration problem because they just drink too much water to cool down the heat. And let's move on. What's next? Uremia. This is called urea. I'm not sure if you've heard of urea. Urea coming from ammonia. And what kind of ammonia? Amino acid. And what amino acid? Proteins. So protein metabolism generate amino acid, ammonia, and urea. And then that's actually the primary reason why we need to pee, because we get rid of urea through the urination. And then uremia means too much urea in the body and in the blood. So what can cause this? Kidney failure. In most cases, uremia causes by kidney failure. And then septicemia. I don't know my pronunciation, okay? Some of you may have a better pronunciation than I have. Septic is bacteria or just pathogens. Okay, I didn't check this one. I'm not 100% sure. I think septic means pathogens, not only bacteria. But anyway, in this case, septicemia in most cases caused by bacteria, and some of those are caused by fungi. But maybe fungi. Yeah, mostly caused by bacteria. And so in the blood, there's supposed to be no bacteria at all, or very, very little. If too much bacteria appear in the blood, even we have antibiotics or we have immune system, still there's no treatment. People will die from it. And if too much, it triggers called sepsis. The sepsis is the systemic immune response to septicemia. And once it happens, people kill, and it's all immune system. And let me see, last one. Leukemia. Leukemia, you may have heard of it. Leukemia. Leuk means white. Here it means white blood cell in the blood. You should have white blood cell in the blood. However, too much, it's a cancer. It's a blood cancer. You generate too much white blood cells in the blood. Hyperemia is too much blood supply in the certain part of the body. Oh yeah, maybe for example, flush. Is it flushing? You say you just be angry with someone, all the blood going to your face. Hyperemia in your blood. What's the last one? Hypercholesterolemia. I studied metabolic disease. I rarely meant this word. Then high cholesterol in the blood, and it's not good. But cholesterol is not really the way that I mentioned. It's only because you have too much LDL in the blood, and cholesterol is the only thing that can be written down by the macrophages. So this is related to sclerosis. Too much cholesterol in the blood is the number one risk factor of the atherosclerosis, and then which further lead to heart attack and brain stroke. So that's it for chapter 3. See you later. And